cannot believe it has been 10 years since we were in high school. It seems like just yesterday we were getting ready for prom with Liz and Jennifer.
Oh, I know, Catherine. I feel like such an old lady some days. I can't believe all of us are married. You and I are even new moms.
I know. I love Jacob, but he can be a handful sometimes. Your Liz is what, 2 months older?
Mm-hmm.
Maybe they can date one day.
Does that make us related? She kept me up all night last night. She's got teeth poking through her gums. I tried to give her one of these ice ringy things. That seemed to work. I think it looks like 2 teeth coming through on the bottom. I don't know. Maybe I should call a doctor.
A dentist would probably be a better bet.
Liz! I can't believe she's a dentist. She's really great with babies, though. Remember she always used to babysit in high school?
Yeah, she's always been good with kids, especially ones with little teeth poking through.
This is perfect. I just spoke with her last night about setting up a time next week for us to meet and catch up. I'll call her tonight. We'll see if she can teach us a thing or two about teeth.
Yeah, I mean, next Saturday is great for me. She's always been a great teacher. Remember all those math classes in high school?
The good old days. All me time, no husbands.
Okay, well, I guess we should take care of business first, but it's not every day that your husbands take the kids and watch the babies. So we can talk about healthy smiles now, and then we can shop later.
Good idea, Liz.
So do you have any questions, or do you want me to just talk about some of the things that I get asked and we can go from there?
How about you start talking and we'll interrupt you with questions?
I'm good at interrupting.
Good. Sounds like a plan. So do either of you know when a baby should first go to the dentist?
When all their first teeth come in?
Well, not quite. You want your baby's first visit to be when their first tooth comes in, which is usually before their first birthday. Now, a baby's teeth first come into their mouth around 9 or 10 months of age. That can vary. And then the ones that you're typically going to see first are the 2 ones on the bottom front.
Yes, that's what Samantha's getting. But why do I have to take her in so soon?
For prevention, Emma, you want to make sure that the dental problems such as cavities don't begin to form. Also, it's important to establish a dental home for your child in order to make sure that your baby feels very comfortable with the dentist.
Well, that sure makes sense, but it's just not what I thought. Well, when do I start brushing her teeth, and what do I do about this teething pain?
Actually, cleaning starts even before there are teeth in the mouth. Now, that's something I didn't know before I went to dental school, and I think that most new moms aren't aware of that. So you want to take like a soft oral toothbrush, a soft toothbrush for newborns, or you want a soft cloth that's moist and you want to clean out their mouth with it. When they start getting teeth in, you can put a smear layer of toothpaste on the toothbrush and brush your child's teeth that way. Now, as for the teething problem, icy rings help, and also cool wet washcloths help. You can let your baby suck on a cool wet washcloth. Another thing that seems to help a lot is if you can take your clean finger and rub your child's gums, and that seems to help alleviate a lot of the pain. You can also use over-the-counter pain medication for your child, but you have to be very careful with the dosage, read the instructions, because the amount that they receive is based on their age and weight.
Well, what about when Jacob's teeth come in? How much toothpaste do I use?
Well, if you're a baby like Jacob, who's under 2, you want to use just a smear layer of toothpaste on the toothbrush. And then from the ages of 2 to 5, you can use like a pea-sized amount of toothpaste. Now, you really want to assist your child with the toothbrushing or even do it for them because they just don't have the skills or the coordination that they need to do a very good job. You really have to help them even up to the 4th grade.
What about thumb sucking? Jacob does that.
Well, thumb sucking is a common habit some kids have. Usually they stop around the age of 2, but it could continue into kindergarten. If they continue to keep sucking their thumb, crooked teeth and bite problems may develop. But this obviously varies from child to child. So if Jacob's still sucking his thumb by the age of 3, then there are some other options. You want to bring him to see me and we can talk about them.
Well, what about the pacifier Samantha uses?
Well, it's the same idea. It's only a problem if he uses it past the age of 3. But there have been studies that have shown it's encouraged from birth to 6 months because it helps to reduce the incidence of SIDS.
What if Jacob gets a toothache? All my friends have been talking about how when their kids get toothache and they're up all night. What do I do then?
Well, you should call your dentist as soon as possible. And then you can have your child rinse with cold water. That may give him some comfort. Also, he can take over-the-counter pain medication just in the appropriate amount because of the age and the weight. A cold compress can be placed on their face if it's swollen to help with the pain. And infected baby teeth can even cause the adult teeth to be malformed or look different than normal. Worse yet, infections can even spread further than just the tooth if you let it go. Some infections become so severe they spread through the face, and they may even require hospitalization.
Well, now you have me worried. I mean, I want to be the best mom I can be and prevent toothache for my baby. What if a tooth accidentally falls out while she's playing? Or what if, worse yet, what if she falls down and knocks out a tooth? I mean, that's one of my biggest fears.
Well, call your dentist as soon as possible. If it's a baby tooth, then it should not be put back into your child's mouth because it can harm the adult tooth that forms underneath the baby tooth. If your child loses an adult tooth, do not scrub the tooth clean. That's very important. We want to keep the cells that are on the tooth alive. You want to rinse it gently with some cold water, and then it'll be replanted back into your child's mouth. If it can't be replanted immediately, you want to put it in either milk or cool water, and then get to your dentist as soon as possible. The sooner the better.
Does that mean baby teeth aren't as important as adult teeth?
Oh, not at all. Baby teeth serve as a foundation for normal growth and development of baby's jaws. The baby teeth also help to create a path for the adult teeth to follow through when it's time for them to come out.
Okay, but what if a baby tooth falls out during an accident?
Well, baby teeth are lost in a certain order to keep the right spacing for the adult teeth that come in later. If a tooth is lost earlier than normal due to an accident, the adult teeth may erupt in the wrong place, causing problems down the road.
What about my baby's diet?
Well, a baby needs a balanced diet. This helps the teeth form properly and keeps the gums very healthy. If your baby's diet is too high in carbohydrates and starches, like cookies, breads, sugars, like especially those in juice and sodas, your baby may be at risk for childhood cavities. We like to see kids limited to 5 exposures of sugar a day. You know, it's not as much what you eat, it's as how many times a day that you eat it. There's really no such thing as a healthy diet whenever it comes to cavities.
Well, if that's the case, I'm not letting my kids have any carbohydrates or starches.
No, don't do that, Emma. Many provide nutrients that your child needs. Just be smart about it. You know, serve it during meals and limit the number of snacks in between meals. You know, sticky foods like jelly beans are worse since they stick around your teeth longer. You know, sticky foods stick around. I'm so cheesy. And along that same line, never put your baby to sleep with anything in their bottle besides water.
Why? My mom always said milk was the best thing at bedtime to soothe their baby to sleep.
Well, milk has sugar in it. Basically, you're letting your child's teeth bathe in sugar all night long. A pacifier or a bottle with some water in it will work just as well. Maybe try a little warm water.
Well, I'll do that from now on. Milk has sugar in it? Well, what about breast milk?
Breast milk is the healthiest choice for a nursing baby up to about the age of 13 months due to the immunological benefits. You need sugar food for the bugs known as bacteria. You need the actual bacteria, and you need the tooth. The bacteria is S. mutans. Do you know that you could share this bacteria with your baby?
You mean I could give this to my baby?
Absolutely. You can do it like if you taste their food with the same fork that they're using before they have it, or if you lick their pacifier after it falls on the floor instead of washing it. You know, then you can give your baby S. mutans.
How do I check for cavities?
You can check for cavities at home using the lift the lip technique. This allows you to see the new teeth that are erupted as well as check for decay. And decay usually starts on the front and along the back of the teeth around the gum line. If you notice white or brown spots, contact your dentist.
Thank you so much for answering all my questions.
No problem.
Thank you. I mean, I'm sure we'll have more questions, but let's get going. I'm ready to shop.
Yeah.